Good morning. Dr. Pinkston here, and you know me to lately have had a lot of great people on the show. I think when I started in radio, I was initially trying to start out doing a lot of great topics about medicine, whatnot, and then all of a sudden it turned into having some wonderful people on the show. And today I'm so excited. I have Kyle Sinclair, who is with me, who has a multifactorial life. He has got so much going on and so interesting. But of course, this is a medical show, so absolutely. I am, highlighting a lot of different things about what Mr. Sinclair is getting accomplished in the medical realm, which is a lot. And he's also a up and coming congressional candidate, so very excited about that too.
Thank you.
And in that, I know that we were talking a few minutes before all this got started. Welcome, by the way.
Thank you.
About so many different aspects of medical care and things that you're involved in. And so give us a minute talk here about who you are and what's going on in your world.
Absolutely. Thank you for having me.
Will it fit in a minute?
I'll fit in a minute. We'll get it. So, I will tell you, I started healthcare and graduated from Weber State up in Ogden, Utah with a bachelor's of health administration, and then had a minor military science. So I did military commissioned as an officer for a medical service corps, spent some time in the military, and then worked in the industry for about 10 years and eventually got my master's in health administration. Found my way doing some business development and operations, so I have a lot of sales background, which there's a lot of people don't realize there's a lot of sales involved in healthcare.
Absolutely.
So eventually went into operations and became CEO of a couple of hospitals. Currently, I'm the CEO for Warm Springs, Thousand Oaks, which is a rehab hospital.
Right.
Kind of interesting. I've been there for about 14 months and I've loved what they do. So been experienced through COVID, and I'm sure we'll talk about COVID through this program. So. Yeah, that's in a nutshell. Like I said, I think I was sharing with you earlier that I have 8 kids. We're a blended family, so it's 8 kids. My wife had 3, I had 3, and we had 2 together. Right. So beautiful family, and spent a lot of time in the community.
Absolutely. And your wife, you said, was a nurse practitioner?
Yeah, my wife's a family nurse practitioner. Right. Her calling in life is hospice. She absolutely loves hospice and that process for them, for a nurse practitioner, they do a lot of recertification, making sure patients, qualify for the benefits and working closely for the needs of the patients and families. So.
Right, exactly. Yeah. So it's funny that kind of going back to something you said a second ago about being a salesman. I teach a lot of students that come through. I have over 10,000 teaching hours over the last 25 years with all sorts of students from, nurse practitioners, PAs, and medical doctors and whatnot. So I tell them all the time, you don't realize how much of a salesman you are actually going to have to be at this job. I think a lot of doctors are terrible at it, honestly. Bookworms, right? So not very easy on the sales aspect. But why do I say that? Because many times we have to talk about certain either therapies, not medications, we don't sell medications and things like that, but about therapies and things that they want them to do to better their lives and do better. So oftentimes I find myself having to, even talk about hormones, having to kind of sell the idea that, this is good for you and whatnot. And so you are so right. I think that's a huge deal. So
can I share one thing? So I keep saying in healthcare, we're in a day and age with healthcare that I always say, if you're not providing good customer service, you're not providing good healthcare. Right. We're at that point in healthcare that is information flows so fast, and that's negative information, right?
Yes, it is, absolutely.
So if a doc makes me mad, or if a nurse makes me mad, or a therapist makes me mad, what do? No. I blast it out. Social media, bad ratings, bad star ratings. Right. So that information get out so quickly. So I instill in my team, not necessarily physicians as much, but more my staff, that if you don't provide good customer service, you're not providing good health care. I don't care how good of a nurse or a therapist you are, you have to have that dimension right now. I'm in healthcare. Everybody has a computer with them.
Right? Everybody does. And so in that too, my dad always said, he was a grocery store owner in a very, very small town in West Texas. And his thoughts were that, the customer is always right. And I know that look on your face, I see it already. It's like, these days I've always wanted to instill it. That's what I grew up with, my dad telling me. And these days, it's really hard. That's too simplistic, I think. But in that customer service, I think you're right, it requires a significant amount of patience with people because everybody is just fast thinking, instant gratification, on fire, a lot going on, a lot of stress. I mean, people are on edge. And you're right, they're very quick to get on and be upset. And so to be able to diffuse that's important. So I'd love to hear what your thoughts on this are. I find that the corporation side of health seems to be, in my mind, what is destroying the whole factor. So I'm a family practice doctor. I have 3 staff in my office. I've seen over 40,000 patients in San Antonio at some point in 25 years. And I have 3 people on my staff. We still answer the phone. We still take calls and do one-on-one talking. And people walk in the front door. Sometimes I'm standing there at the front window still. So that to me is something that is very lost on, the corporate side, and it's at one-on-one. And I feel like that's where things turned and went wrong.
Yeah, I mean, I would agree and say, in addition to that, I mean, you look at healthcare in general. I mean, we know we spend 60% of every dollar we spend is on administration.
Yes.
It's a massive amount of administration. I have like I said, a bachelor's in master's health administration, and I still don't understand healthcare, right? And almost 20 years of experience working in multiple industries within healthcare. It is very, very, very hard to understand. And so now you see why, on the side of the patient, why there's high bankruptcies. Right? A lot of financial hardship that comes from healthcare.
Right.
They don't understand how to navigate. We have physicians that don't even understand how to navigate the system. You got administrators in hospitals. I mean, it's a massive, massive problem in healthcare. I love healthcare. I sleep, eat, and drink it, but we're the best and the worst healthcare system in the world, period.
It's so true.
And then you can start diving into multiple sectors of why, but we literally are the best and the worst system.
Right.
We're the most expensive. Right, around the world.
Absolutely.
I mean, we spend 17% of our GDP, which is like $7 trillion a year.
Right.
I mean, it's just an exorbitant amount of money. And we're not the best. We don't have the best outcomes.
Right.
I mean, we got to be honest.
Right.
We're not.
Right. It's backwards in a lot of ways. I think that, too, some of what is lost upon me with patients is that I think now the way we're trained and the way we envision trying to work with patients about their health, it's more of an algorithm or recipe-based system where, and I bet your wife definitely can speak to this as well, that, a patient sits in front of me, I've got 10 minutes with them to figure out their entire life and what they're going through. They got a lot of things they want to talk about, but I got to treat their cholesterol. So I just check the boxes here and then write the prescription out the door.
Yeah.
And I've fought that for all 25 years, trying to make sure that patients don't feel that way when they're in, and and teach nurse practitioners too in the teaching that there's still an art about medicine. Don't forget that there's people sitting in front of you. Yeah. Sit and listen to them long enough. They're going to tell you what's wrong with them, but stop checking the boxes and just understand what's going on with them. And there is no recipe to it. I know we've got guidelines. I know we've got a lot of those things, but just keep remembering there's a human in front of you that, you've got to think about, not just check off and run out the door.
Oh man, that's so. I mean, I went to my physician last week and literally spent 20 minutes with him, which I walked away and told my wife, I was like, I can't remember the last time I spent that much time with my personal physician.
Right.
And most average are like 2 to 5 minutes.
Right.
On the primary care, because the individual primary care physician is a dying breed. You and I were talking about that before the show, and in order to maintain the low revenue reimbursement the physician gets, they've got to increase their volume.
Absolutely.
The only way to increase your volume is to spend less time per patient.
Right.
And we create this scenario where now you're chasing insurance authorizations, they get denial rates just as much as we do.
Yeah, that's true.
I'll tell you my personal opinion, I think the insurance has too much power.
Absolutely. Absolutely.
I have fought with physicians, this is the right thing. Kyle, I agree with it, but they're not going to approve it.
Right.
That's
it in a nutshell. You just hit it right on the head. I think that's what I have fought the most over time, is trying to stay independent as a solo practitioner, and it's based on being a patient advocate and fighting the insurance industry. I know why we have it. I understand the cost of medicine, blah, blah, blah. I got thrown off of a Medicare Advantage plan because I was spending too much money. Mm-hmm. And I was like, well, patient needs a CT scan. I'm sorry. I don't really want to put that in my pocket while they're dying of some tumor in their belly. And I'm sorry. I'm just not going to do it that way. So that's it. I'm off. And it's sad that we have to focus on medicine in that direction. You're right about having to spend a few minutes with patients. I have spent most of the time about 5 to 6 times a day. I see probably, 21, 22 patients a day, because if I do more than that, then I am a 2-minute doc and I can't do that. So there are many patients I'll spend 45, 50 minutes with.
Love it.
And a lot of times I know one of my longtime patients are there because they bring their knitting or their book. Not that people wait on me all that long, but they'll bring their knitting or their book or something, and they know they are going to get their time with me, and they're okay with that because I won't run out on that. But how do we solve that? Now that we've got it, how do we solve it?
That's a really
loaded question,
complicated question with a lot of factors. I don't know if we'll have time in the show. Right. I think there's a lot of aspects that need to be fixed in order to help with that. And I think, and partly why I'm running for Congress is we need to be able to fix it.
Right.
And it starts at the legislative level. Some of the regulations that come across that are coming down are people that have never been in the industry, have never worked in the industry, have never stepped foot in a hospital, have never worked there or sat with a patient.
Or even been sick.
Or possibly even been sick.
Right?
Absolutely. Or, they have a different set. So I would say that's part of why I'm running. And again, I'm not trying to get political, but that's partly why I'm running is we need people who have sat in the seat, who have lived it, who have spent hours upon hours fighting for what's right to try to do what's little money we get to be able to take care of patients.
Right.
And that's impacting the industry. So I would say that's number one. And that's a whole nother subject, a whole nother time.
Right.
But you got to start at the top and work your way down. Because I really do think, and I know hundreds of physicians in San Antonio, they do at their heart love healthcare. They went into healthcare to treat patients and to take care of patients.
Right.
They didn't get into it to become rich. They didn't get into it to spend a exuberant amount of energy and hours away from their family. No, they got it because that's their calling.
Yes.
And I don't think that's gone as an industry.
Well,
I don't
it's
think
disappearing.
You are seeing a lot of physicians
burnout.
leaving. It is, but I think it's more the administrative burnout.
Right.
They're tired of the denials. They're tired of being pushed to practice the way they don't want to practice.
Exactly.
Right. They're forced to do tests in order to get reimbursed. It's so I can go on and on. But that's the shift. You're seeing the power in the insurance is impacting the physician and how they direct care.
Absolutely.
And then the rest of us, like myself, or administrator, we live with it, and we've got to figure out.
Yeah. And when I sit with patients, I'm a solo practitioner still. I haven't sold out yet.
Great for you. That's awesome.
It's hard. I'm telling you, I'm pretty tired, and burnout is affecting me as well.
Yeah.
But I sit with a patient. Oftentimes they'll say something about, I my copay or the cost or whatnot. And I'm like, I purposely do not know what insurance you're on or whether I'm being paid or not, because legitimately half the time, I don't get paid for what I do. Yeah. I do half of what I do for free.
Yeah.
And so I purposely don't know that, so I don't start to treat somebody differently, because if you think, it affects everybody. If you think that, well, I'm not going to get paid for this anyway, sometimes you might cut things short or whatnot. So I purposely shield myself around that. Not that I don't watch my money, I have to, but, shield myself away from that, because that is it. You really don't realize how many doctors half the time do not get paid for what they do. And sometimes it's $20, $30 for that 45 minutes that I sat with somebody.
All day long, physicians talk to, share the stresses, and that's why they join these big practices, because they've got to they have to cover some of the cost of not being able to do tests or not being able to do X, Y, and Z, or needing to do stuff. So
exactly,
it's a
tough one.
It's tough. Like I said, it's the best. We have the best healthcare in the world. You have the best access to it. You have the best. It's amazing. It's the best broken system we've ever had. Right?
I love that. Yeah, that's a quote.
Obama started to try to shift and change, which I'm grateful for. There's a lot of impacts, factors that we need to fix, even from the Obama standpoint. But it did a start of it.
Right.
President Trump put in the price transparency without a lot of meat behind it, so that never got a lot of traction. I think price transparency is huge. We got to know how much. I can walk in to get a knee replacement. They tell me it's one price, and they get a massive bill when I get home. Right. You got to
pay the doctor, you got to pay the hospital, you got to pay the anesthesiologist, you got to pay the rehab facility, and it all separately. It's not like one, Yeah, and it has.
That's if you've met your copay, right? So
or your deductible.
Or your deductible copay.
So
it's complicated.
It is.
It's very, very complicated. That's. We've got to fix it.
Yes.
We've got to fix it. Yeah. We have a beautiful medical community here in San Antonio. It's the #1 industry in San Antonio. Mm-hmm. We have great healthcare providers. We got great hospitals. It's a great thing in San Antonio.
Yes.
Being the 7th largest city in the United States and second to Texas, and a huge economy, it's just, we've got to work together. And unfortunately, it's not just at the local level.
No,
So.
it is. It's going to take a lot. And I hope at some point we don't see the primary care and the solo practitioner, completely disappear. But I'm seeing it fall off the face of the earth these days.
That's interesting you say that, because you look at, when I was doing my Master of Administration, we started looking at versions of socialism or social health care, right? So a big governmental paid system. But it's interesting is the difference is they put a lot of emphasis on general practice, GPs, our primary care GP to them, and preventive maintenance.
Right.
So I will tell you, number one, insurance is a big thing for me. I love insurance. I have insurance as needed.
Right.
The problem is, as a community, we use insurance completely wrong in healthcare.
Right.
Completely wrong.
That's interesting.
So we don't use car insurance to go fix our tire, to go change the oil, to change our wiper blades, right? We use car insurance at a catastrophic, that's it.
Right.
That's it. But for healthcare insurance, we use it for everything. Sniffle, runny nose, bleeding, ER, everything, right? Yeah. So, and that also drives up the price as people are uneducated, the community is uneducated where to go.
Exactly, and do that. So.
And they use the ER as a primary care physician or a clinic.
That is so true.
And the price goes up. So I do think that burden needs to be passed on to the recipient of the insurance. If you're going to go for a sprained ankle to the ER, which costs thousands of dollars, you need to take some of that burden. You will change their behavior.
That's so interesting. You say I tell patients a lot of times they'll come in from the emergency room and say, well, they didn't do anything for you. I'm like, they are there to make sure that you're not dying right now.
Absolutely.
It's my job to work it up. So
absolutely.
We are going to take a short break, and coming on the flip side, I've got something I want to talk to you about. That's awesome. Thank you. The term beauty is only skin deep takes a new meaning when you find a medical spa that works one-on-one with your individual needs in a safe, relaxing atmosphere. And with medical spa on every corner, why would Dolce Beauty and Laser be different? Owner Lisa Trinquier has designed the ultimate medical spa experience. Botox fillers, laser hair removal, facials, weight loss, body sculpting lasers, an infrared sauna, and more, your body and anti-aging experience is waiting. Our injector specialist has greater than 10 years of experience, more than any other injector in San Antonio. And with me, Dr. Pinkston, as medical director, we provide the ultra-innovative experience. Go to dolcebl.com, that's DOLCEBL.com, and contact us for a free consult and 10% off your first service. Call 210-686-0505. We are located off I-10 on Camp Bullis Road in North San Antonio at 6865 Camp Bullis Road. Hey there, we are back. I am with Kyle Sinclair today, we have talked a lot about insurances and medicine and things that I don't know if we've solved anything yet, but we're trying.
Absolutely.
We were just having a discussion though about the cost of healthcare and insurance coverage, lack of, or whatnot. And interesting point that you're bringing up about how it's backwards, how we are paying forward for things that we shouldn't necessarily need to. We should like a car insurance on the back end and whatnot. So I'll let you. You're more eloquent than I am. I'll let you go forward.
Absolutely. I was sharing the reality of what happens when you go, say, a procedure in the hospital, right? So you have a hospital bill, then you have your copay deductible, multiple physicians add on, right? Anesthesiologist adds on. They're typically, whether they're in network, out of network, and all the costs related to that. And so the reality is that it's very tough to manage it as a patient, somebody who's never been in healthcare. They don't understand the bills, and typically they get a massive bill when they get home.
Right. I have insurance.
And I have insurance, right? Mm-hmm. And so that's very, very, very tough. But when you do the process correctly, even people such as myself, I was sharing with you, my wife had a procedure, and we did the same thing. Paid the copay up front, paid my deductible, still had some out of pocket, got a massive bill on our end.
Right.
And so I fought it, let it go, and I was sharing with you, I let it go to collections because if I pay cash, I get a cheaper rate.
Right. So I was telling you as well that there was a period of time I had to go without insurance because I have rheumatoid arthritis, so it's a pre-existing condition. I can't get insurance until Obamacare came out. I was able to then fight the pre-existing and do go on the healthcare market and get a plan through the Affordable Healthcare Act, but still $1,000 a month. But I look back, and the amount of money that I spent as a private pay was so much less, and it worked well because if I had something done, I was able to negotiate a cash price.
Yep.
So when I got an x-ray, it's a $250 x-ray, but if I pay for it up front, it's $50.
Yeah.
And so people need to know that they can negotiate with that. Cash is very, very, still good.
It's
for
so
vision.
in any business, cash is king, right? So for that very reason, that hospital, that physician, that X-ray company, they've got to collect it from the insurance. They've got to fight it. They've got to wait for the authorization, the approval. They might be denied. They might be recouped money.
Administrative costs.
Absolutely,
costs. So,
it is. So again, a cash is a huge option that I think a lot of people don't realize in healthcare. You can negotiate set rates.
Absolutely.
But I would say, for me, on the flip side, is we've still got to get better at price transparency. I've got to know what this X-ray is going to cost me up front.
Right.
So I can negotiate.
Can you make that decision about which way you're going to go with it?
And that's tough. That's tough. Again, if you've never been in the industry, that's very complicated. And typically you have an emergency or something health related going on. You don't want to turn around and fight with an insurance or a hospital administration or sometimes even a physician to get the best care. So
I created a job in my head for myself now, so I'm always doing stuff like that. But I've approached a couple of medical schools, even nurse practitioner schools or whatnot, about teaching this type of stuff so that when they're out, they can help negotiate, not negotiate, but navigate their patients through a lot of the system. Because I've learned a lot. I was there when the HMOs first broke, and we went from paying a doctor out of pocket to HMOs and insurance. I was there when that changed. So I've learned a lot, but build something where physicians know, you teach them so that they can help their patients navigate all that. Although it changes every 6 months, but
it does. And my only advice on that is I don't want my physician worrying about the navigation piece. I want my physician healing me.
Right. Well,
right. So, but there are companies that help navigate. They're not massively popular or widely known.
Right. But I have to.
But physicians do need to get educated on that.
We need to know and understand.
And they go. But again, as I shared earlier, they're great human beings, and their call in his life is to protect and heal ailments in people, and that's really why they get into it.
And that's part of the protection, though.
It is.
It's being their advocate, even though it's about bills and things like that. Now, how do I get my patient their labs? What do I order so that they don't wind up getting this huge bill? And unfortunately,
I will tell you, we have resident physicians that come through our hospitals from UT Health. So rehab physicians, PM&R physicians come through and do residency. So they get exposed to post-acute. We've done some in-services for UT Health physicians. We've done some in-services through Brooke Army for their resident physicians. So as a company and organization, post-acute medical, or PAM Health is what we're also called, we do a lot of education into the community on the post-acute services. Again, most physicians are geared towards acute level, short-term acute hospital versus the post-acute, the real world outside of that.
That's the most important part.
And there's a lot of physicians do that. And a lot of people don't realize that your community physicians all don't go into the hospital, right? So you have these differences of, credentialing process.
That's another place I got kicked out, is the hospital system. I can't go in and see my patients in the hospital, even where that old traditional, deal is done. Yeah. We have killed the last 25 minutes just insanely quickly, but I have enjoyed this immensely. And I hope I can have you back. Absolutely. How can people find you and reach you and find out more about you?
Yeah, absolutely. So I would definitely say from the professional standpoint, they can look up our organization. It's Post Acute Medical is the website. We have 5 locations here in San Antonio. I'm the CEO of one of our hospitals. That's Post Acute Medical or PAM Health, Warm Springs, Thousand Oaks. So it's in the northeast part of the corridor. Professionally, I'm on LinkedIn, about 30,000 people I'm connected to, Kyle Sinclair. And then for Congress, it's Kyle for 20, KyleFOR20.com.
Gotcha.
And I'll tell you, healthcare is a big platform. I'm talking with Bear County Medical Society, and they're very interested in what I have to say and help out. So.
Well, happy to. All of this will be on my website. Perfect. So drpbetterlife.com. Every link in the world, everything you can find, it is all there if you would like to find out more about Mr. Sinclair. And it has absolutely been a pleasure.
Thank you so much. Thanks for having me.
Yeah, absolutely.
Thank you.